Hi, I am DIPEPTIDYL peptidase inhibitor 4. My generic names are linagliptin, sajagliptin, and setagliptin. My brand names are Onglyza, Genovia, and Semlin. My chemical name is DIPEPTIDYL peptidase in 4. My drug classification for therapeutic is that I slowed the breakdown of GLP-1 to prolong the effects of increased insulin secretion, decreased glucagon secretion, and slow GI emptying. My pharmacologic classification is anti-hyperglycemic agents.
DIPEPTIDYL is under the pregnancy category B. Safety in humans has not been proven in adequate and controlled studies. Insulin is the drug of choice in patients with diabetes who are pregnant. DIPEPTIDYL mechanism of action. DPP-4 inhibitors are to increase incretin levels, which inhibit glucagon release, which in return increases insulin secretion, decreases gastric emptying, and decreases blood glucose levels.
My pharmacokinetics is that for absorption, DIPEPTIDYL peptidase-4 inhibitors are readily absorbed orally. Following oral ingestion, absorption occurs mainly in the small intestine with median times to maximum peak plasma concentration ranging from 1 to 3 hours. The fraction of each dose absorbed ranges from approximately 30% with linagliptin to 75 to 87% for all others. Numerically differences in maximum peak plasma drug concentration in areas under the plasma concentration time curve among the DPP-4 inhibitors vary by an order of magnitude. My distribution is strongly influenced by both lipophilicity and protein binding. Apparent volumes of distribution for most agents range from 70 to 300. Linagliptin exhibits a volume of more than 1,000 liters, indicating widespread distribution into tissues. Binding to target proteins in plasma and peripheral tissues exerts a major influence upon broadening linagliptin distribution. My metabolism is widely variable, with reported terminal half-lives ranging from approximately 3 to more than 200 hours. Complex relationship between rates of receptor binding and dissociation appear to strongly influence the durations of actions of those DPP-4 inhibitors with comparatively shorter half-lives. Durations of activity often are not reflected of clearance, and with the exemption of vidagliptin, which may be administered either once daily in the evening or twice daily. These medications are effectively when used with a once daily dosing schedule. My indication is to improve glycemic control without causing weight gain or increasing hypoglycemic risk in patients with type 2 diabetes mellitus or T2D. My contraindication is allergy to sulfonylureas and other anti-diabetic agents and avoid hypersensitivity reactions. For type 1 diabetes, these patients do not have functioning beta cells and would have no benefit from the drug. For pregnancy and lactation, potential adverse effects on the fetus or neonate. My side and adverse effect for per body system. For central and peripheral nervous system, I will give you headache. For gastrointestinal system, I will give you abdominal pain, diarrhea, and nausea. And for integumentary system, I will give you painful skin and red or purple rash. Then for eyes, ears, nose, and throat, I will give you sore throat and runny nose.